Epilepsy. It's a word that carries weight, often shrouded in misunderstanding and apprehension. But at its core, epilepsy is a neurological disorder, a disruption in the brain's electrical activity that manifests as seizures. These seizures, varying in type and intensity, can impact individuals differently, affecting their daily lives in profound ways. But here's the crucial message: epilepsy is manageable. With knowledge comes power. The power to understand the complexities of this condition, identify the right course of treatment, and navigate life with epilepsy confidently. In this video, we're diving deep into the world of epilepsy, exploring its various forms, delving into the latest advancements in management and treatment, and empowering you with the information you need to live a full and meaningful life. This is about taking control, shattering stigmas, and embracing a future filled with hope and well-being. Imagine a sudden surge of electricity engulfing the entire brain. That's the hallmark of a generalized seizure, a type of seizure that affects both sides of the brain simultaneously. These seizures can manifest in various ways, from the abrupt loss of consciousness and muscle stiffness in tonic-clonic seizures, to the brief lapses in awareness characteristic of absence seizures. Understanding the nuances of each type is paramount. Tonic-clonic seizures, often the most visually dramatic, involve a loss of consciousness, followed by muscle rigidity, and then rhythmic jerking movements. Absence seizures, on the other hand, are more subtle, marked by a vacant stare and a temporary disconnect from the surroundings. The impact of generalized seizures extends beyond the immediate event. They can leave individuals feeling fatigued, disoriented, and sometimes with temporary memory loss. Recognizing the specific type of generalized seizure is crucial for determining the appropriate course of treatment and management. Unlike generalized seizures that engulf the entire brain, focal seizures originate in a specific area of the brain, like a sudden electrical surge in a localized circuit. These seizures can manifest in a myriad of ways, depending on the affected brain region and the extent of electrical activity. Simple focal seizures often involve localized symptoms, such as twitching in a specific limb or experiencing unusual sensations. Complex focal seizures, on the other hand, can lead to altered consciousness and engage in repetitive, involuntary movements. Imagine someone suddenly picking at their clothes or smacking their lips, seemingly unaware of their actions. The implications of focal seizures can be significant, impacting cognitive function, motor skills, and emotional well-being. Accurately identifying the type of focal seizure, along with the affected brain region, is critical for tailoring effective treatment strategies and minimizing potential complications. Think of anti-epileptic drugs, AEDs, as the first line of defense in the battle against seizures. These medications work tirelessly to restore balance within the brain, calming the erratic electrical activity that triggers seizures. AEDs come in various forms, each with a unique mechanism of action. Some AEDs work by enhancing the activity of GABA, a neurotransmitter that inhibits nerve signals, effectively putting the brakes on excessive electrical firing. Others target different neurotransmitters or ion channels involved in nerve impulses, modulating their activity to prevent seizures. The selection of the optimal AED is a personalized decision, guided by factors such as the type of epilepsy, seizure frequency, potential side effects, and individual patient characteristics. Finding the right AED is often a journey of trial and adjustment, requiring close collaboration between the patient and healthcare provider to achieve optimal seizure control. Beyond the realm of medication, lifestyle modifications play a pivotal role in managing epilepsy and reducing seizure frequency. Think of these modifications as empowering tools that work in synergy with medications, optimizing brain health and promoting overall well-being. Adequate sleep is paramount. Just as a machine needs rest to function optimally, so does the brain. Sleep deprivation can disrupt the delicate balance of brain activity, increasing the likelihood of seizures. Establishing a regular sleep schedule, ensuring sufficient hours of sleep, and creating a conducive sleep environment are essential steps in epilepsy management. Stress, that ever-present companion in modern life, can also exacerbate seizures. Implementing stress reduction techniques, such as mindfulness meditation, deep breathing exercises, or engaging in hobbies and activities that bring joy, can significantly impact seizure control. Remember, a calm mind often translates to a calmer brain. Imagine having a roadmap, a clear set of instructions on how to navigate the unpredictable terrain of a seizure. That's the essence of a seizure response plan, a personalized guide that empowers individuals with epilepsy and their support network to respond effectively and safely during a seizure. A comprehensive seizure response plan outlines the specific type of seizure the individual experiences, the typical duration of their seizures, and the potential triggers that could precede a seizure. This information is invaluable for family, friends, colleagues, and caregivers, enabling them to provide appropriate assistance when it matters most. The plan also details the steps to take during a seizure, ensuring the individual's safety and well-being. This might include instructions on gently guiding the person to the floor, cushioning their head, and clearing the surrounding area of any potential hazards. Equally important is knowing when to seek immediate medical attention, such as in cases of prolonged seizures, or if the individual experiences difficulty breathing. In the ever-evolving landscape of epilepsy treatment, medical devices have emerged as powerful tools, offering innovative solutions for seizure control and improving the quality of life for individuals with epilepsy. One such device is the vagus nerve stimulator, VNS, a small surgically implanted device that sends regular mild electrical pulses to the brain via the vagus nerve. Think of it as a pacemaker for the brain, helping to regulate electrical activity and reduce seizure frequency. Another groundbreaking advancement is the Responsive Neurostimulation System, RNS, a device implanted within the skull that continuously monitors brain activity. Like a vigilant guardian, it detects unusual electrical patterns indicative of a seizure and delivers precisely targeted electrical stimulation to disrupt the seizure before it fully manifests. Imagine a dietary approach so powerful that it can alter the brain's energy source, shifting it from glucose to ketones, and in doing so, potentially reducing seizure frequency. That's the essence of the ketogenic diet, a high-fat, low-carbohydrate diet that has gained recognition for its effectiveness in managing epilepsy, particularly in cases where medication alone hasn't provided adequate control. The ketogenic diet, often initiated under the guidance of a healthcare professional and a registered dietitian, involves a strict regimen of carefully calculated macronutrients. The goal is to induce a state of ketosis, where the body, deprived of its primary fuel source, glucose, begins to break down fat into ketones, which then serve as an alternative energy source for the brain. While the exact mechanisms by which the ketogenic diet exerts its anti-seizure effects remain partially understood, research suggests that the metabolic shift induced by the diet may alter neurotransmitter levels, reduce inflammation, and improve mitochondrial function, all of which could contribute to its therapeutic benefits.